If you're dealing with constipation, feeling bloated, struggling with straining, or finding yourself sitting on the toilet with that frustrating sensation that you haven't fully emptied your bowels, then I invite you to try something with me right now. It will take only 60 seconds of your time, yet it just might be the gentle nudge your digestive system needs to spark a natural wave of movement and get things flowing again. Your intestinal tract is not simply a passive, inactive tube running through your body. It's an incredibly dynamic living structure that relies on organized, rhythmic waves of muscular contractions, something known as peristalsis, which work tirelessly to push waste material steadily along your digestive highway. But when that coordinated muscular activity begins to slow down due to factors like prolonged sitting, sudden shifts in your daily routine, heightened emotional stress, inadequate fluid intake, side effects from specific medications, or even consuming too little or too much of certain types of fiber, you can quickly start feeling backed up, heavy, uncomfortable, and sluggish from the inside out. So here's exactly what I'd like you to do alongside me today. Right now, I'm demonstrating this technique while standing because it allows you to see each movement clearly and precisely. However, please know that you can perform this technique in whatever position works best for your body while standing upright, sitting comfortably in a chair, lying down on your back, or even resting on your side. The absolute key here is to consciously keep your abdominal muscles soft, relaxed, and free of tension while applying only gentle, soothing, and comfortable pressure with your hands. To begin, place your hand on the lower right side of your abdomen, right down in that area. From there, you will slowly and deliberately massage upward, moving along the right side of your belly until you reach the area just beneath your right ribs. Then, you will glide your hand horizontally across the upper part of your abdomen, moving toward the left side. Finally, you will continue by massaging downwards along the left side, heading all the way toward the lower left portion of your abdomen. Once your hand arrives at that lower left spot, lightly ease up on the pressure, simply soften your touch, and then return your hand back to that starting point on the lower right side. Repeat this exact same pathway all over again. Why this particular route? Because you are faithfully following the natural, gentle direction that stool travels through your large intestine, mimicking its anatomical path to encourage optimal movement. Keep performing this soothing circular massage for roughly 60 seconds, all while taking calm, slow, and deliberate breaths. Breathe in deeply and comfortably through your nose, and as you exhale gently through your mouth, allow your belly to fully relax and soften with each outward breath. A vital reminder: never push hard, dig in aggressively, or continue the massage if you feel any pain or sharp discomfort. Your comfort and safety are always the priority. Interestingly, abdominal massage has been researched and studied as one potential technique that may assist in improving bowel function and alleviating constipation in certain individuals. So even just 60 seconds of this simple practice can do wonders to help stimulate your digestive tract and encourage things to start moving in the right direction. It's such an easy, accessible starting point, and if it feels comfortable and beneficial to you, you are welcome to continue that gentle massage for a longer period beyond the initial minute. But there's another factor that can truly make a significant difference in your digestive health. And when we talk about timing, one of the most powerful windows of opportunity to get your bowels active is in the morning, especially right after you wake up, and particularly after you've eaten your first meal of the day. Your colon naturally becomes more active and contractile following a meal, thanks to a physiological response known as the gastrocolic reflex. When food enters and stretches your stomach, it sends signals cascading through your entire digestive tract, encouraging the colon to contract and make space for the new incoming food. That's exactly why many people naturally experience the urge to have a bowel movement shortly after finishing their breakfast. So instead of dismissing or overriding that natural urge because you're rushing out the door or occupied with your daily commitments, you want to consciously harness and honor this reflex. Wake up your system. Drink a glass of water to rehydrate, move around gently for a few minutes to get your blood flowing, and eat breakfast if that aligns with your usual routine. And when your body sends you that clear signal, listen to it promptly and head to the bathroom. Now, once you're seated on the toilet, your posture and positioning can make a world of difference. Elevate your feet by placing them on a small stool, a sturdy box, or any firm surface that lifts them so that your knees end up positioned slightly higher than your hips. From there, lean forward comfortably, resting your forearms or elbows lightly on your thighs. Relax your abdomen fully and focus on breathing deeply and evenly. This specific position alters the angle between your rectum and your anal canal, effectively straightening the passage and making it significantly easier to empty your bowels completely without having to strain excessively. Please do not turn your bathroom time into an intense physical workout. If you find yourself pushing, forcing, and straining hard for prolonged periods, stop right there. Excessive straining elevates internal pressure and can contribute to uncomfortable issues such as hemorrhoids, which are best avoided altogether. And here's a fact that surprises many people. Constipation does not necessarily mean you haven't had a bowel movement for several consecutive days. You could be going daily and still be constipated if your stool is persistently hard, dry, or difficult to pass, if you frequently find yourself straining, or if you consistently experience that incomplete emptying sensation after each attempt. Now let's shift our focus to fiber, because this is where many well-intentioned individuals end up making a critical misstep. When they become constipated, their immediate reaction is to suddenly load up on massive amounts of fiber in an effort to fix the problem overnight. Fiber is undeniably crucial for normal, healthy bowel function, but more is not automatically better when introduced abruptly. If you dramatically escalate your fiber intake while your digestive system is not yet acclimated to it, especially without simultaneously increasing your fluid consumption, you can end up experiencing more gas, more bloating, and significantly more abdominal discomfort than before. The smart approach is to increase your fiber gradually, allowing your gut to adapt over time and to obtain that fiber primarily from whole, real, unprocessed foods. Excellent choices include a vibrant variety of vegetables, fresh fruits, hearty beans, nutrient-dense lentils, wholesome oats, tiny but mighty chia seeds, ground flax seeds, digestion-friendly kiwis, and the classic remedy, prunes. All of these are fantastic options that support healthy digestion. And equally important is to give that fiber sufficient fluid to work with, because specific types of fiber actively hold on to water, which helps soften your stool and makes it much easier and more comfortable to pass. Another essential element that your colon genuinely craves is physical movement. This does not mean you need to commit to an exhausting, high-intensity workout every single day. Even small, consistent habits like getting up from your chair at regular intervals or taking a brief 10-minute walk, particularly after a meal, can get your entire body moving and, in turn, stimulate your intestinal muscles. It's a simple yet effective way to support and enhance intestinal motility. If you spend the vast majority of your day seated and your body barely moves from that sedentary position, then you really shouldn't be surprised when your digestive system starts to become just as sluggish and slow as your lifestyle. And let's not underestimate the profound influence of your nervous system on your gut health. Your brain and your digestive system are in constant, bidirectional communication through what we call the gut-brain axis. When you are chronically stressed, perpetually rushing, eating your meals in a hurry, or constantly holding tension in your body, your digestive patterns and rhythms can shift and become disrupted. That's yet another reason why I encourage you to incorporate slow, intentional breathing during the abdominal massage and to consciously relax your entire body when you sit on the toilet, rather than trying to force things or make them happen through sheer pressure and willpower. Additionally, there's one more habit I strongly urge you to change: repeatedly ignoring the natural urge to have a bowel movement. Your body is giving you that signal for a very specific physiological reason. If you continually postpone it because you're busy with work, social commitments, or other distractions, you can over time interfere with the healthy routine your body is diligently trying to establish. So hold these key principles in mind. Your bowel thrives on movement, moisture, and routine. Begin with that gentle abdominal massage we practiced together. Take full advantage of the natural increase in colonic activity that occurs in the morning and following meals. Drink adequate amounts of fluids throughout the day to stay well hydrated. Gradually consume more fiber-rich, whole foods to nourish your system. Move your body in some way every single day, even if it's just a short walk. Position yourself correctly on the toilet to optimize your alignment. And most importantly, when your body tells you it's time to go, honor that message and listen attentively. These seemingly small adjustments may sound insignificant when considered individually, but together they can create a tremendous cumulative impact on how comfortably, regularly, and efficiently your digestive system operates. And please, always keep this in mind. If your constipation is a new development, or if it is persistent and doesn't seem to improve, or if you experience severe abdominal pain, worsening pain, vomiting, blood in your stool, unexplained weight loss, fever, or any significant unexplained change in your bowel habits, do not simply continue treating yourself at home. Seek a thorough evaluation from a qualified healthcare professional to rule out any underlying conditions. However, for ordinary, occasional constipation that comes and goes with lifestyle factors, start working in harmony with your body instead of fighting against it. Give that 60-second massage a genuine try. Get yourself moving on a regular basis. Provide your digestive system with the hydration, fiber, proper positioning, and consistent routine it genuinely needs to perform at its best. And you may just be pleasantly surprised by how much more easily your body can do exactly what it was beautifully designed to do. If you happen to know someone who's always complaining that they just can't go, please consider sharing this video with them. You would truly be doing them a wonderful favor by passing along these practical, helpful insights. I sincerely hope this video serves you well and provides tangible value for your health. Please feel free to leave your thoughts, questions, or comments down below. I always appreciate hearing from you. And most importantly, make it a great day. I'm Dr. Alan Mandell.